guys, Dr. Andy here. Today I want to demo and tell you a little bit about what we do in terms of our chiropractic treatment for back pain. Okay, so if we kind of discussed in the previous videos, back pain is a pretty darn broad topic. A lot of patients will come in and they'll say they have back pain, and it could be anywhere between the low back, even the hips, all the way up into right below the neck, so what I would consider the mid-back. So what I'm going to tell you and show you a little bit about is how chiropractic care or how a chiropractic manipulation or chiropractic adjustment helps with that. Okay, so by far the most common reason why you have back pain is not structure related, which means that it has nothing to do with how your back looks like. So nothing to do with maybe a scoliosis, it has nothing to do with some arthritis, it has everything to do with how well the joints and the muscles are functioning and moving in your back. So what we do during our previous assessment, what we've learned from Miss Katie is that, we've ruled out any kind of red flags. We don't need special imaging, we don't need to make a referral to one of our friends at an orthopedic office. We know that Miss Katie has a functional related back problem, which means that the muscles are tight and the joints are jammed. They're just not working very well. So my job is to help everything just function and move a whole lot better. We want to increase the mobility of her spinal joints, okay? The chiropractic adjustment and the chiropractic manipulation is actually very successful in doing this, okay? What we do is we find the joints that are not moving very well, and we deliver a very quick, very shallow, meaning I'm not pushing very deep, little push, all right? And what it does is it helps the joints function and move a whole lot better. And it helps the muscles surrounding those joints to start to relax, okay? So if the main reason we have back pain is because the muscles are too tight and the joints are not moving very well, well then chiropractic adjustment, the chiropractic manipulation, which helps increase joint motion and helps muscles relax and take away some of their spasm or some of their tightness, is a very effective treatment. So I'm going to show you two different techniques that we do, one for the upper back and then one for the low back, to help these joints move a little bit better and help these muscles start to relax, okay? So as I said, we've already kind of done the exam, the assessment, we've already kind of ruled out any kind of red flags. We know that all we got to do is just help the back function better, and it will help take away the pain, okay? So Miss Katie, what she's going to do is she's going to be taking a deep breath in, she's going to let it out, I'm going to follow her down, and then just deliver a quick little push, okay? Go ahead and do that for me, Miss Katie. In and out. There we go. And a lot of times, just like that one, we heard a little pop from around the area where I pushed. That's called a cavitation. It's the formation and then release of little gas bubbles from inside the joint that have kind of been building up in there. It's the same exact thing as cracking your knuckles, okay? So that's for the mid-back. It's going to help the mid-back move a little bit better. And now I want to show you what we do for the low back. So Miss Katie, do me a favor. You're going to come on this side, face that way. Perfect. Let's make the neck a little bit more comfortable. Bottom leg is going to stay straight, top one we bend. We get the patient nice and comfortable, eye contact in the low back, and all we do is just roll the patient over just a smidge. There we go. And apply a little force into the low back to help that joint move a whole lot better. Okay? So as I was saying, chiropractic adjustment, the chiropractic manipulation, very effective for increasing mobility in the low back, which is the main cause of back pain. Okay? So if you have any questions, send them my way. Always remember to live with passion and not pain.